Thank you so much again, Representative Bizzarro. I'll turn things over to you for initial thoughts, and then we'll go right into the Pennie presentation.
Well, thank you, and good evening, everyone. For those of you that don't know me, I'm Representative Ryan Bizzarro, and I represent the 3rd District here in Erie County. Uh, I'm happy to have the opportunity to host this virtual town hall tonight about Pennie, and Pennie is your connection to health coverage in Pennsylvania, and Pennie is the only place that will link you to additional financial assistance from the American Rescue Plan to lower your monthly payments and/or out-of-pocket expenses. I don't know if the folks caught who I'm co-hosting this event with tonight. It's the Pennie's outreach manager, Scott Yeager. Mr. Yeager, good evening, and thank you for co-hosting this important town hall event with me.
Absolutely, Representative. And with no further ado, I will start by introducing people to who Pennie is and what we do. Specifically, Pennie, if we start with our name, Pennie is actually a sort of a play on words. It's PENN, which is Pennsylvania, I, which is insurance, E, which is exchange. And Pennie is quite literally the official replacement for healthcare.gov here in the Commonwealth of Pennsylvania. It was through an absolutely unique piece of legislation. And again, thank you again, Representative Bizzarro, for your support and for your continued support of what was a revolutionary piece of legislation for the Commonwealth of Pennsylvania. Pennie, prior to July 2nd of 2019, when Governor Wolf signed us into existence, we were sending, as a Commonwealth, we were sending nearly $98 million a year back to healthcare.gov by way of enrollment fees. What's really unique about Pennie is that there were some forward-thinking policymakers, some forward-thinking legislators in Harrisburg who got together on behalf of the Commonwealth of Pennsylvania and said, you know what, we can do this better. They actually created 2 programs out of 1. They created a competitive state-based marketplace here in Pennsylvania, one that provided the Commonwealth of Pennsylvania and the residents of the state with local control. And we also created a reinsurance program that acts a lot like a thermostat in your home. It helps regulate the monthly premiums and rates that people pay throughout the Commonwealth of Pennsylvania for their health insurance premiums. And through a unanimous bipartisan effort in both chambers of the Pennsylvania General Assembly, Pennie was given birth to. And since then, we have done a tremendous amount of work in trying to make sure that people here in Pennsylvania are aware not only of the fact that Pennie's here to take a subject that is very, very confusing and create clarity from that subject. We're here to make sure that people have awareness of the fact that Pennie has financial assistance available, and that's what makes us different from any other pathway to insurance, is the fact that we have financial assistance available for individuals. We're the only source in the individual health insurance market for financial assistance. And ultimately, who are we here to help? We are here to help people who are unable to access employer-sponsored coverage. We're here to help individuals who do not qualify for Medicaid or CHIP, who aren't yet old enough to qualify for Medicare options. We're also here to help small business owners, sole proprietors, and individuals who might be small precision manufacturers or agribusiness owners. We're here to make sure that people who think that they don't have options when it comes to getting covered, realize that there is help, there's financial assistance, and that we're here to provide that enhancement to your quality of life. That's what Pennie does. Why do we do this? Well, as you'll see here in a moment, 1 in 20 of our friends, our neighbors, maybe even our family members here in Pennsylvania go without health insurance every day. Um, that's something that we can remedy. That's something that Pennie is working very, very hard every day to remedy, especially during our open enrollment period. Our open enrollment for 2022 actually started on November 1st of 2021 this year. We have a grand deadline that's approaching, and that deadline is for January 1st coverage. Anyone in Pennsylvania who needs coverage by January 1st needs to reach out to Pennie by December 15th. That's next week. So please understand, we want to encourage everyone to connect with us. If they need to discuss their insurance options, if they need to review insurance plans that they currently have through Pennie, we want to hear from you. Because at the end of the day, we have a no wrong door policy here at Pennie. If you, through working with Pennie, if it's determined that you're better served under Medicaid or CHIP, we'll make sure that there's a warm transfer there for you. In fact, we'll even send your application information over to them so that you don't have to start from scratch. Now, when it comes to how Pennie helps, we actually have 4 different layers of service here at Pennie. Number 1 is self-service. We do our very, very best at pennie.com to make sure that people have a platform where they can learn about health insurance, learn about financial assistance, review their health and dental insurance options, and then ultimately secure that insurance if that's something that they want to do. We also have an unbiased, no hassle customer service line, 844-844-8040. It's important to note at this point that Pennie is not an insurance company. We're the marketplace where, under the Affordable Care Act, all of the health insurance plans, gold, silver, and bronze, that we sell through Pennie, through our marketplace, are brought to us by the best health insurance carriers here in Pennsylvania. And all of those plans adhere to the 10 minimum essential health benefits that are set forth by the Affordable Care Act. Things like emergency care, outpatient services, urgent care services, substance abuse and mental health services, maternity, newborn care, prescription drug services, and the list goes on. Also, if you're an individual who is, in a position where you may have a pre-existing condition, you can't be denied coverage through Pennie because you have a pre-existing condition. Also, if your parents are insured through Pennie and you're under the age of 26, you can remain on your parents' plan. So Pennie has a lot of assistance available, but our customer service line and pennie.com are the first 2 that are very important. The customer experience here at Pennie is customer driven. But we also recognize the fact that not everybody likes working online. Not everybody likes working over the phone. So we have thousands of Pennie certified brokers across the Lakeland region, literally in Erie, Crawford, Venango County, etc. There are thousands of Pennie certified brokers across Pennsylvania who can literally sit down with you in your local community and help you review your options and find those health insurance plans that are best for you. We also, through our network of assisters in Pennsylvania, We have individuals in local communities who work for hospitals, health centers, faith-based organizations, and community organizations who will be there to provide you with unbiased assistance in gaining access to the care and coverage that you need to protect your quality of life. Now, you've heard me say a couple times that we've got a challenge in front of us with regard to the uninsured here in Pennsylvania. If you take a look at this heat map, it is very, very sobering. There are 607,000 individuals represented here on this heat map. The darker the blue, the more uninsured. One of the things that I'd like to point out is you'll see that there's 12,000 in Erie County, 6,100 in Crawford, 2,900 in Warren, 5,100 in Venango, 6,500 in Mercer. Here's the interesting thing about that. It's all relevant to population. 12,000 uninsured individuals in Erie in 2021 is unacceptable. We're here to help. We have financial assistance available. We have the ability to get people protected. But we also understand that health insurance is a frustrating topic. A lot of times when you mention health insurance to most people, they'll act as though you've given them a glass of lemonade without the aid part. And that's justifiable. But Pennie is here again to bring clarity to a situation where you might have confusion and to provide support to individuals that just want to get to a better place. Now, here's the interesting thing. Under the American Rescue Plan, and again, thank you, Representative Bizzarro, for your help, for your support, for making financial assistance available to those who need it most. Under President Biden's administration on March 11th of 2021, the American Rescue Plan was signed into law. Through Pennie, we have been able in 2021, and we will be able to in 2022, we'll be able to provide enhanced financial assistance that will improve access to coverage and care. Prior to the American Rescue Plan, there was a subsidy cliff. That subsidy cliff was anyone who was over, as an individual, $51,000 a year. Literally, if you made $1 more a year, you were in a position where you received no financial assistance for the individual health insurance market. For a family of four, if you made over $105,000 a year, you received nothing. Well, the good news is that for 2021 and 2022, we're able to cap premiums at no more than 8.5% of the household income over 400% of the federal poverty limit. Now, where does that make a difference? Well, I've got a few scenarios to share with you that will help drive this point home. All of these scenarios are based upon, again, remember I said at Pennie, we have gold plans, silver plans, and bronze plans. All of these plans are based, or all of these scenarios are based upon our second lowest cost silver plan. Okay. Those second lowest cost silver plans are really, really good insurance. Typically, they have very manageable copays, deductibles, co-insurances, but they also have premiums, monthly premiums that are very, very manageable for most people here in Pennsylvania. The first scenario that I have here is an individual who makes about $19,000 a year. Now, if 2021 and 2020 or 2020 and 2021 have taught us anything, it is that we're in a position where we may have individuals who are unemployed, And because of that, some folks have lost their employer-sponsored coverage, and they may be in a position where they're working 2 jobs. They may work 3 jobs, or they might work a full-time job and not have access to employer-sponsored coverage. We think of a lot of folks that Pennie's here to help. Individuals that might be starting a small business. They might be a gig worker doing Uber, Lyft, DoorDash, things like that. So for this scenario, this individual makes about $19,000 a year. Okay. Prior to the American Rescue Plan for that second lowest cost silver plan, Pennie's benchmark plan, this person would have paid $66 a month. Now, for some folks, that might not sound like a whole lot, but trust me when I say this. If you're somebody who makes $19,000 a year, $66 a month, that's a lot of money. Now, under the American Rescue Plan, because of the enhanced financial assistance for 2021 and 2022, we're in a position where we can provide this person with $0 per month premiums and a savings of almost $800 a year. Okay. Now, the second scenario that I have to share with you is of a married couple. They are 64 years old. They have worked very, very hard. They have saved up their money. They have done everything right. But the one reality that a lot of folks who retire early come to grips with is the fact that health insurance, no matter what your income level, health insurance is incredibly expensive. In their case, together, they make $77,580 a year. Okay. Prior to the American Rescue Plan, this couple, to cover 2 people, would have paid $2,462 a year. That's a lot of money. That's unbelievable. Now, because we cap their premiums at 8.5% of their income, this couple now pays, under the American Rescue Plan, $550 a year. That saves them almost $23,000 in a year's time. If you are a couple, if you're an individual who's heading into retirement or a period of consulting before retirement, saving $23,000 a year can be life-altering. In fact, as we sit here right now, of the 337,000 Pennie customers, couples like this represent about 36% of our customer base. And to be quite honest with you, we are so happy to be in a position to help them. But we're also happy to be able to help families like this. This is a family of 4. They make $52,000 a year. Prior to the American Rescue Plan, this family of 4 would have paid about $285 a month to cover 4 people, which, if you think about it, that's not too bad. However, under the American Rescue Plan, this family of 4, for our second lowest cost silver plan for Pennie's benchmark plan, which is great insurance, they pay just a little over $20 per person. $87 a month. That's less than some cell phone bills and less than most cable bills. So they save about $2,376 a year. Like I said, I mention all of this to you because in the history of the Commonwealth of Pennsylvania, there has never been a better time for individuals to get covered and get protected. In fact, as part of having local control, as Pennsylvania's new health insurance exchange, Pennie created a COVID-19 enrollment period. That COVID-19 enrollment period was from February 15th to August 15th of 2021. And thank you again, Representative Bizzarro, for your help in getting the message out for the COVID-19 enrollment period, because of your efforts and your support of Pennie, we were able to actually insure an additional 65,000 of our friends and neighbors here in the Commonwealth of Pennsylvania. In fact, the great news under the American Rescue Plan is that nearly 50% of our current customers right now at Pennie pay less than $1 a month for their health insurance. 68% pay less than $50 a month for their health insurance. It's been a very, very good year in terms of protecting people here in the Commonwealth of Pennsylvania. And speaking of protection, Pennie, as I mentioned before, we are in our second annual open enrollment period. We are literally 1 year and 1 month old as we sit here right now. As of November 1st of 2021, Pennie kicked off our open enrollment for coverage year 2022. An important deadline is looming next week, December 15th of 2021. If somebody you know, if a friend, a family member, someone in the community you know is looking for health insurance options, please have them reach out to Pennie before December 15th. They will be in a position where they will be able to secure coverage for January 1 of 2021. Now, as part of our local control here at Pennie, we also realize that there are a lot of folks that are going to get caught up in the holidays. They're not necessarily going to have health insurance as something that's going to be top of mind, especially through this time of year. For those folks, December 16th to January 15th, the end of our open enrollment period here in Pennsylvania, we provide them with the window of time, a month, to be able to shop for plans, compare plans, and secure health insurance for February 1 of 2022. Now, beyond February, January 16th to December 31st, there are special enrollment periods here at Pennie. Special enrollment periods are 60-day windows of time that are opened up because people have qualifying life events. And a lot of people, they think that once open enrollment closes up, that Pennie goes away. We don't. We are here to help no matter what time of year it is. And some of those qualifying life events that open up special enrollment period windows are things like a birth in the family, getting married, getting divorced, a death in the family, gaining lawfully present status here in the United States, being here on a worker visa, student visa, green card, path to citizenship, okay? Individuals who may be recently released from incarceration, that opens up a qualifying life event. Moving from, let's say, Pittsburgh to Erie, that would open up a qualifying life event. You'd be in a position where if you lost your employer-sponsored coverage, you'd be in a position where that's a qualifying life event that would help you secure coverage through Pennie. So I mentioned all of that to end on the topic that is very, very important. And that is, at Pennie, you're never alone. You have free support. Some of the support is virtual. Some of the support is right in your own community. But the one resource I need to make sure everybody's aware of is the fact that Pennie's call center is no hassle, unbiased professionals. Again, they don't work for insurance companies. They work for you. They work for the Commonwealth of Pennsylvania. And you can reach out to them at 844-8040, Monday through Friday, 8 a.m. to 7 p.m., or Saturday, 8 a.m. to 1 p.m. Throughout the Commonwealth of Pennsylvania, we have thousands of Pennie certified brokers who you can connect with through pennie.com or through calling our customer service center. Our customer service representatives can refer you to a Pennie certified broker in your community if you prefer to work with somebody in person. It's the same way with our Pennie certified assisters. They work through hospitals, health centers, faith-based organizations, and community organizations all across Pennsylvania. You can opt to work with them if that's what you choose. At the end of the day, the most important thing to know is that with Pennie, you're not alone. We get it. We understand that health insurance is challenging. Health insurance can be health insurance can be intimidating. But we want to try and help get you to a point where you're protected, where your quality of life is protected. And ultimately, if you know somebody who's struggling, trying to figure out if they qualify for health insurance through Pennie, have them call, reach out to us. I think you'll be surprised at what you may find. With that being said, I'd like to thank Representative Bizzarro again for hosting us this evening.